given everything you just mentioned now, what's your take on the progress so far, looking at, everything you've mentioned? Where are we now?
There are a lot of success stories. In some aspect, one can say we have even achieved more than what we have laid to achieve within the first 2 years. Because what we did was to have a short-term indicators within the first less than 3 months, and then the 2-year midterm, and also the 4 years. So this is the midterm, and one can categorically say it and congratulate Nigerians that a lot of progress have been made. So under the leadership of the Coordinator Minister of Health, he took all these priorities of the President, the campaign promises, and also came up with an approach and processes of how best to deliver and realize. And I'm happy to say that we have been on track from the areas that he has done, because he deployed new innovations and a new way of ensuring that we achieve the promises of President Bola Ahmed Tinubu under the Renewed Hope Health Agenda. So he came up with what he called the sector-wide approach, and also the National Health Sector Investment Initiative, which galvanizes all existing efforts and bring all efforts together in terms of resources, human resources, financial resources, political commitment, not only at the national level, but sub-national level, including all donor support and development partner support under one umbrella to deliver. And he prioritized also under the 4 areas what is called the population health, the security aspect of it, the presidential health value chain, unlocking that, and also other aspects of partnership, and then healthcare delivery. Okay. So when you look at all those, one can categorically mention, and if you take it back also to the Renewed Hope Health priorities of President Bola Ahmed Tinubu, one can mention in each sector what progress have been made. So the first the President did that time was to ensure that all subnational governance, the government, aligned with his priorities. And that was what he launched, if you recall, as early back as December 2023, where all the governors signed a compact agreement, which is an agreement that they've aligned with the priorities, and they've aligned to align all resources, and also committed to ensure that they also deliver along with the President at the subnational level. I think this was achieved, and a lot of governors have demonstrated that commitment. Another area is when you look at the financing area, the success story. Immediately, His Excellency President Bola Ahmed Tinubu expanded the national health insurance coverage for Nigerians by increasing also the basic health care funding, which has been in the pipeline since 2018 and has been operational. But what he did was to increase and boost that basic healthcare funding, which comes from our 1% consolidated revenue fund. Yes, so that was expanded, and the whole idea is to increase the coverage of healthcare for vulnerable people, and also the vulnerable fund. So which means from 8,000 PHCs that we've had in the past 2020, as of 2023, to increase it to realize the double it to up to 16,000 by 2014. And I'm glad to mention that over 1,000 primary health care facilities, as of today we are talking, they have been rehabilitated, they are functional, in the words of Nigeria, in each local government of the Federation. And over 5,000 are also in the pipeline at different levels of completion. So if this is done within the next few months, it means we have almost surpassed the indicators that we have agreed for primary health care. So that is in the area of that. And then if you take another area, still in financing, you can see that His Excellency President Bola Ahmed Tinubu, in partnership with the legislators, has sustained increment, which has continued over the period from 2023 budgetary allocation, 2024 budgetary allocation, and today at 2025, there has been an increment. And the budgetary allocation is slightly above 5% as we are talking. So those are demonstrations in terms of financing, that are domestic financing, and also this is just at the national level. But in addition, a lot is also happening at the subnational level.